Hi, I'm Dr. Mehboob, MD Ophthalmology from Aiims, New Delhi, and we are here with our continuation series of Take a Sip with Ophtha where we discuss the important topics related to the Neet PG, Next PG and FMGE examinations. That is very important because here in this series we discuss every topic in 3 to 4 minutes, and after which you will be able to solve most of the MCQs related to that topic. And we are covering almost all the important topics of the ophthalmology. So do watch this continuation, this series, and you will be having a great and fun learning. Thank you. Now we are here with this our SIP 11, that is corneal dystrophy part 2. Earlier in the part 1 we have discussed about the definition and the classification of the corneal dystrophy. Corneal dystrophy is very important. Now here we are going to discuss the different types. One is the epithelial and subepithelial dystrophy. We have already discussed that what we are following, the classification is IC3D classification, okay, which was modified in the 2014 IC3D classification. This IC3D classification has the different classification. Means what previously used to do, that anatomical classification was there, like according to the layers. We have the epithelial dystrophy, we have Bowman's dystrophy, we have stromal dystrophy, we had Descemet's and endothelial dystrophy. But it has been found that the dystrophies, the layer are not actually the distinction mark between the dystrophy. Means one dystrophy can spread from one layer to another layer. Means they can be in the epithelium, in the subepithelium, or in the stroma also. So there is a need for the classification, and that's why we come up with the idea of this one. Okay, now coming to this epithelial and subepithelial dystrophy, let's see first. This corneal dystrophy is having the classification according to IC3D: epithelial and subepithelial dystrophies, epithelial and stromal TGF beta 1 dystrophies, stromal dystrophies and endothelial dystrophies. In this SIP we will discuss only this epithelial and subepithelial dystrophies, only the relevant types, because there are so many types. Only the relevant types will be discussed here. The most important is the epithelial of the subepithelial dystrophy is the epithelial basement membrane dystrophy. The spelling is wrong. Epithelial basement membrane dystrophy. Okay, so this epithelial basement membrane dystrophy is also known as Corneal dystrophy. So this can come like this Corneal dystrophy also. What is the important points to remember according to this? It is the most common type of all dystrophies. The most common type is EBMD, epithelial basement membrane dystrophy, Corneal dystrophy. What is the other name of this dystrophy that we can call it? See here what I have written: dot-like, map-like. So it is also known as map dot-like dystrophy. It is also known as map dot-like dystrophy. Okay, map dot-like dystrophy. Okay. Now what is important to understand here, that see the feature, how does this cornea look? Here there may be the dot-like manifestation, okay, and there may be the map-like manifestations. So this is very important. What is the types of inheritance? Many of the types I have already told you. There is one exception to the hereditary basis. Corneal dystrophy there are the 4 things that should be there. Okay, one of this hereditary basis, but this is an exception where we have the sporadic type of transference. So it is very important. Second point is the RCE, means recurrent corneal erosions. RCE, recurrent corneal erosions. Again and again there is erosions, and because of that there can be the pain. So you have to give the patient a lot of lubricant every time. Okay. Second point is that what happened in this condition? There is a fibrillary protein deposition. Where there is a fibrillary protein deposition between subepithelium and Bowman's membrane. This fibrillary protein deposition is there. Okay, between subepithelial and Bowman's membrane. So it's very important to understand. And when you see this type of picture, dot-like, map-like picture very clearly on retroillumination, so you have to remember this point. So what is important here to remember, it is the most common type, map dot-like feature, and it is sporadic. It is very important, these 3 points. Coming to the next point, treatment is simply lubrications. Obviously in the very advanced cases, you can go for the TPK, that is therapeutic penetrating keratoplasty, but LASIK is contraindicated. Okay, LASIK is contraindicated, or any type of refractive surgery is contraindicated in this because of this recurrent corneal erosions. Moving to the second type, Meesmann corneal dystrophy. Can you see this? What is this? These are the so many intraepithelial cysts. And this is called Meesmann corneal dystrophy. It's an autosomal, very important question. They can ask it. I have told you many intraepithelial cysts. This one is the many intraepithelial cyst here, and this is the central non-reaching limbus. This is the central non-reaching limbus. Okay, central non-reaching limbus, meaning it involves mainly the central area, but limbus is usually spared here. It involves the mainly central area, but limbus is usually spared. Moving to the third, these are just for the sake of completion of this. Least epithelial corneal dystrophy, where you will have the broad fibrillary band-like thing. Remember, broad band-like thing. This is our feathery. This is the two term, broad, band-like, or feathery. This is the two term that will come in here. Only this much you have to know. It is X-linked, or most of them are autosomal recessive. Some of them are autosomal dominant, but very few of them are X-linked. So this is very important. They can ask you X-linked. This is X-linked. Moving to the important point, just for the name, completion, sake of completion, gelatinous drop-like dystrophy. It's a grape-like dystrophy, mulberry ball-like dystrophy. You can see the mulberry ball-like things. It is an autosomal recessive. What is this? Autosomal recessive. Okay, it's an autosomal recessive, and there is a subepithelial, sorry, here it is not this, it is the subepithelial amyloidosis. Subepithelial amyloidosis means amyloid deposition, we can say here. This is all about the epithelial and subepithelial corneal dystrophy. Do like this, do watch the other part of this, because this is very important. There are the 5 SIPs that is related to, means 5 videos related to this corneal dystrophy, and it's very important. Thank you very much.